Have you ever wondered about the ABCs of retiree health insurance? Well, stay tuned because we're going to cover that today.
I'm Archie Hoxton,
And I'm Rob Hoxton.
and this is Last Paycheck, weekly wisdom to help you retire and stay that way.
Welcome back to Last Paycheck. I'm your host, Rob Hoxton. Archie Hoxton, the co-host, is out today. He's on leave. He and his wife just had their first child, so we're really excited as a family to welcome little Annie to the world and to our family. Today's episode, I think you're going to find very interesting, especially if you're close to retirement and you're starting to wonder about healthcare and health insurance. Today's guest is Scott Aschoff, and he is with Medicare Back Office. He and I have worked together for quite a few years now to help our clients really navigate the whole environment of health insurance post work years. And I think you're going to like Scott. Scott, welcome to the show. We're glad you're here.
Rob, thanks so much for having me. Glad to be here today.
I'm glad you're here, and it's very timely. You know, with open enrollment starting on, I believe, October 15th. We'll be having this episode and one more to help people make smart decisions. But this is a great time for us to be having this conversation, I think, isn't it?
Absolutely. It's the perfect time to get ready and make sure you have everything you need.
So most of our listeners tend to be people, Scott, who are, close to retirement or have retired. And I know when I was studying for my certified financial planner designation, the part on health insurance was the least interesting part to me. I have to admit, I'm sorry. I know you probably just are energized by it, but I found it somewhat complicated and hard to understand. And because I was studying when I was in my 20s, I knew that Medicare wasn't something I needed to be immediately worried about. Now, as my clients have aged along with me, they are really interested in Medicare and all of the various details and inner workings of it and what it covers and what it doesn't, what it costs, what it's going to cost next year. So I wonder, it might be helpful. I know it would be helpful to me if you could just maybe start by walking us through Medicare, the original Medicare that we all have coming to us at 65.
Absolutely. And so for what it's worth, Rob, you're right. As much as this is what we do every day, typically it's not the most interesting topic, but yet very necessary. And so to get into Medicare, there are the two main parts that Medicare starts with. And if you are familiar, they go by the letters. So you have Part A, which is the hospital insurance for Medicare. So just covering hospital stays, just like it sounds. This is pretty basic. As long as you qualify, which is very similar to Social Security, you get Part A and there's no cost to you. Then Part B of Medicare is the medical insurance. So if you think about, typically, most people refer to this as like their health insurance as for Medicare. Now, some people are surprised by this, but there is a premium you pay for Part B of Medicare. This year, it starts at just under $165. Next year, for 2024, it's going up about $10, so just under $175. But that is also based off of your income. So that's another surprise some clients have, is that in those higher income brackets, it can get over $500 per month per person. And so that does go into the importance of knowing how it all works, the true costs, what it does cover, what it doesn't cover, and making sure you have the coverage you need as you get into retirement and on to Medicare.
So Part A, which is the hospitalization, is something that we don't as retirees pay for. But Part B, I think you just said, Scott, that we pay for it, and we pay based upon our income, I guess, right? The more income you have, the higher your premium. Is that right?
Absolutely, yes. And again, it can get quite significantly higher, over $500 in the top two income bracket.
So there's this concept that we talk about as financial planners. I know that you talk about a lot, called IRMA, which I believe stands for income related monthly income adjustment. And that's the piece of this where your premium on Part B goes up, right?
Correct. Yeah. So that's the part that will increase it from $165 in general to over $500. Now, the one last thing I'll add in there, Rob, is it is delayed. So, like 2 years is what they typically call it. And so the Part B premium you pay for this year, 2023, is actually based off your income from 2021. And so for those clients, especially as they just get into retirement, if they've been working and had a certain amount of income, and then that income does go down, especially significantly as they retire, there can be a pretty big difference from what they're paying and what income bracket they fall into compared to where they're at now or when they get into retirement.
I like to kind of weave real life stories from the world of our financial planning practice into this. A couple of weeks ago, I was meeting with a client, and in their financial plan before they retired, we planned for them to have a fairly large expenditure on a new, it was a Toyota Sequoia. These are large SUVs, they're expensive. And one of the things that I was worried about is if they took an unusually large distribution from their IRA or 401k in 1 year to buy this vehicle, I was concerned that it would have an impact down the road on the cost of their Part B. And in fact, it would have. And so we were able to get them to sort of do this transaction across the top of the calendar, so to speak. So we'll take some distribution in December, a little distribution in January, then hopefully they can buy their vehicle in the new year and stay below that break point or marginal level as far as their taxable income and the IRMA. So I noticed that you have a designation RICP, and I believe that is about retirement income planning, isn't it?
It is. So it's actually a three-part test. The first two revolve more about, the investment side, planning for income, and so forth. But the third part does get into the Medicare side. And so that, again, is where it does become quite relevant into what we do every day here.
Yeah, I should say this is not an advertisement, but I should say that, Scott, you've done a great job for our clients, and it's a subject area that I'm not an expert. So as a fiduciary, I have a duty to bring an expert in, and you've done a great job for our clients. One of the best things about working with you is this little book. It's just a down and dirty. You can read it over a cup of coffee. It's called Navigating Medicare, and it comes from Medicare Back Office and Scott's team. And I'm sure if any listeners would like to have a copy, we'll put Scott's contact information in our comments area, and you can maybe reach out to him by email and get a copy. But it's a super organized, very down and dirty explanation of how this all works. So we've talked a little bit about Part A, which is your hospitalization. Tell me again what Part B covers.
That's the medical insurance. Most people just refer to that as your health insurance of Medicare.
So that's where, like, if you go to the doctor or something like that, right?
Checkups, everything else, if you will, yes.
And then what about Part D?
So yeah, Part D to me is the easiest part of Medicare because it covers your drugs or your prescriptions and your medication. So that's another part that you typically do need, and that's another part you have to apply for when you become 65 or get onto Medicare to avoid a penalty. And so you do want Part D to cover that. Make sure that, again, you're not surprised by any high out-of-pocket costs when you get onto Medicare and you go to Walgreens or CVS to get your prescriptions.
Scott, you just said something that I think we ought to probably highlight, and that is that you have to enroll in these insurance coverages when you reach 65 or close to. Talk a little bit about that and what the impact is of failing to do that.
Yeah, so it's a great point, Rob. So when you turn 65, you have what's called your initial enrollment period, which is a 7-month window around your 65th birthday. So it's 3 months before the month you turn 65, the month you turn 65, and then 3 months after. So again, 7 months. If you don't apply for Medicare at that point and you have no creditable coverage, which again, we'll probably bring up another question, but if you have no coverage, you're a group or employer or through a spouse, then that's when the penalties can apply. And there are penalties for Part A, Part B, and Part D. So all three of those that can apply to what you're paying for. And so you don't want to miss them. Now, when you break it down, they're typically not huge amounts, but they are also, like Part D, I know specifically, it's a lifetime penalty. So if you
Every
miss it,
year you pay a higher premium?
correct. And it does also, it's calculated off of every month. So if at 65 you have no coverage and you wait 5 years to get a Part D plan, you would have 60 months, if we just use a round number, calculated by that penalty that's added that you're going to pay extra for the rest of your life. And so it's typically not something you want to do. The other thing is, again, when you have someone guiding you through the process, they're typically very low cost, or even certain plans that are zero premium plans. So you can avoid the penalty, not have to worry about it, but still have coverage, but also not be paying, hundreds of dollars more to avoid it either.
So you said something just now that kind of piqued my interest. You said no cost plans. Can you elaborate on that, Scott?
Sure. So specifically when it comes to Part D, there are certain carriers in certain areas, and this is where it can depend on, where you're at. Are you in a more metro area? It depends on your state. So I do want to be very clear on that, as plans can differ significantly depending on where you're at. But we have a carrier that specifically, if you want to say, made it a goal that next year they're offering a drug plan for zero premium. Now, a thing I always like to say is when it comes to healthcare, and especially when it comes to Medicare, you're going to be paying for this one way or the other. So if you're not paying for a premium, you're typically paying because of either limited or a very small percentage on any copays or out-of-pocket costs. So you're typically going to have a much higher percentage that you're going to be responsible for as you need the plan or as you get treatments or prescriptions in this regard. But you're going to be paying for it one way or the other. But again, if you're 65, you need to take little or no medications, but you want to avoid the penalty, that can be a great option where you're not paying a premium. You meet the Part D requirement, you've applied, you don't have the penalty, but again, you're also not paying every month just to have it.
That's a great tip. You also mentioned something about qualifying for Medicare and it being somewhat like qualifying for Social Security retirement benefits, if I heard you correctly. What do you have to do to qualify for Medicare?
So it is a very minimal one, and it does really only apply for Part A of Medicare, the way I understand it is. So it works like Social Security where you have the work credits. And so in most cases, if, because I believe it's even a lower minimum, I guess this is where pretty much everyone we talk to does qualify. It's not an issue, but if you qualify for Social Security, you'll qualify for Part A, and then you do not have a premium for Part A. You can still actually get Part A for Medicare if you don't meet that, and then you would pay a premium. Again, it's quite honestly rarely comes up, but it is something where you do qualify for it. You have the benefits by work credits, and then there's no premium for Part A.
So just so everybody knows, in order to file on your own record and qualify for Social Security retirement benefits, it's 40 quarters of service, which basically is 10 years in the system. So just to give you an idea there. And then you also used a term, I believe, creditable coverage. So tell me about that. And I think that has to do with if I am working still when I'm 65 and I have health insurance through my employer that I like.
Yeah, so that's another great question, Rob. Probably one of the most common questions we get is if you're 65 and either you're still working or your spouse is, and you're getting health insurance or group plan through that work, that is what's considered creditable coverage. The one stipulation the government has is if the employer has 20 or more employees. So what they typically say is if it's less than 20 employees, you then have to go to Medicare. That becomes what's called your primary insurance. If you have more than 20 employees, any large company, your group plan, your health insurance, that stays your primary. Medicare can become your secondary insurance if you want. What we found though, Rob, in a lot of cases, and when we go case by case, most clients, if you're 65, your employer is more than 20 employees, so it qualifies as creditable, you don't have to sign up for Medicare. You can delay signing up, applying. There won't be any penalties. What happens is when you do retire, whether that's a year from now or honestly 10 years from now, you will get a letter from your company saying, hey, Rob worked here. He's had creditable coverage this whole time. Now is when his initial enrollment period starts. Now is when his clock starts for any penalties. So in a lot of cases, if you're still working, and again, it's a large employer, that health insurance will typically cover it and you're good there. You can actually delay signing up for Medicare.
Okay, that is hugely helpful. So are there any other forms of creditable coverage?
Typically not. So where you do have to be cautious, and this is where, Rob, I say it all the time, but Medicare is just so personal. Like, it's just so case by case. But
Yeah.
if people think about Cobra typically does not qualify. You have to get on the Medicare. If you've heard of like the ACA or those individual health plans, typically that does not qualify. Once you turn 65, you should get on the Medicare. So I do go back to, that is where someone like ourselves or anyone who's independent who can walk you through it and hopefully not charge you as well to go through that process and say, here are the questions to ask, whether it's your employer or the plan you have, to make sure you go whichever direction so that you have coverage, but you're not penalized either.
Those are great points, Scott. So getting some help is an option that you have. I know that there are lots of insurance agents that sell various types of insurance, which we're going to talk about that type of insurance in our next episode for next week. But one of the things that I like about the way you all operate is that your experts, your agents, your licensed representatives are they're independent, so they don't represent a single company, number one. Number two is they're not paid by commissions. They're paid a salary to do the work that they do. So while I'm sure they would like to gain a client by talking to one of our listeners, that's not how they're being paid. And so I think that I think that's a great compensation structure to make sure that people get just good, honest advice. And I think that that's one of the things that I like about the way y'all operate. And the other thing is that you know what you're talking about. So are there any that you can think of? Are there any other things about Medicare that people need to be really aware of? Any pitfalls? Are there any areas where there's big gaps in coverage? And I know we're going to talk about how to cover those gaps in our next episode.
I mean, I don't think so. Like, once you start, then you apply for Part A, Part C, you get Part D, the drug plans, you avoid those penalties. Those are the big key things. Maybe just to piggyback from what you did say there lastly, and I appreciate everything and being a partner. You've been great to work with, and we always appreciate that. But no matter who you use, do get someone who's independent and quite honestly represents more than one carrier so they can give you options. I mean, I'm not saying you can't go to someone who only represents, one carrier, but then I would strongly recommend you then do talk to someone else, get a second opinion, make sure you're comparing. Because typically what we see is that is where clients do get caught, if you will, or they get, if you want to say, in trouble with how much they're paying out of pocket, where they just meet with one person, and it's the first person they talk to. They love the person, it sounds great, but then as health issues come up or as they need the plan, they didn't realize, I have an $8,000 deductible, or I'm paying $5,000 out of pocket. They don't understand that. It wasn't explained to them, whatever the case might be. But if you can find someone's independence to go through all your options, give you side-by-side comparisons, typically the best way you can go so you have the best plan going forward. I mean, what we always typically say is you have that one window when you turn 65 or the first time you go into Medicare, but then that's it. You're on Medicare for the rest of your life. So it's an important decision.
That's great. Thank you so much. We're running out of time here. I did want to remind viewers and listeners that this little booklet, Navigating Medicare, you can reach out to Scott and ask for it. You can also reach out to me by going to the podcast website and just sending me a message. But definitely get the information that you need. Be an informed consumer, and if you need help, get it, because this is pretty complicated stuff. We appreciate your tuning in for this episode of Last Paycheck. We hope that you'll like it and follow us and tell your friends and family. And if you have an idea for a show or something you'd like to hear about, leave it in the comments and we'll be sure to get to it.
You've been watching Last Paycheck, weekly wisdom to help you retire and stay that way. If you like this show, be sure to hit like and subscribe. Last Paycheck is available anywhere you get your podcasts.